Hey YouTube, Nurse Leslie here, the Beauty on Duty. Today's video is part 2 of my new series called What's in the Bag. And today I'm going to take you through my lab bag. And in the beginning of our program, we actually got something called a nursing care packet. And inside there are lots of goodies that we have. Some of them we've used, some of them we haven't. And I'm just going to show you a few. Here is a vial of 0.9 sodium or 0.9% sodium chloride injection solution for use as a sterile diluent. Okay, and then I have a 3 milliliter syringe. Anybody need some medicine? Can't wait to start poking people. So excited. Next I have gauze sponges, good for wound care, cleaning wounds. Then I have an ABD pad, also good for wounds, and some bandage tape. Next I have 3-gram sterile packet of water-based lubricant. Can be good for a lot of different things. NG tube insertion, Foley catheter insertion. Of course, when you're doing things like that, you need gloves. These are sterile gloves. I have something here called a Carpuject sterile cartridge unit. I don't know what this is. We haven't used it yet, and I'm pretty sure it's coming up next semester, so that should be fun. I think it actually works along with this little 0.9% sodium chloride injection little needle. I think they work together. Not sure yet, but I'll give you guys an update later on and let you know what we use it for. We have here a secondary medication set. It has a hanger and a lock adapter for use with continued flow solution set. I believe that is this. Yes, continued flow solution set. I believe it's for IVs. Hooking up IVs. We haven't gotten to that yet, but it's going to be next semester in med-surg. I got a big old bag of 0.9% sodium chloride injection, 500 milliliters for IV. I have a suction catheter kit for suctioning tracheostomy patients. I have a tracheostomy clean and care tray, which consists of the tray, powder-free vinyl gloves, a drape, pipe cleaner, gauze, cotton tip applicators, trach dressing, brush, and twill tape. Trach care was incredibly simple. I was so surprised. I was really scared. I was really grossed out. But when I actually got the chance to do it, it was really interesting, really simple, really cool. I think it also has a mask inside just in case they start spraying secretions and things. You don't want that. I have a dressing change tray with ChloraPrep, which consists of skin prep pad, powder-free vinyl gloves, cotton tipped applicator, a mask, 3 pieces of gauze, tape, dressing, and ChloraPrep. Dressing change, again, something that's kind of gross, especially with all the secretions, how do we call them? Exudates? Yeah, the exudates. They can sometimes be smelly, they can sometimes look really gross, like, you know, stage 3, 4 decubitus ulcers. My gosh, have I seen some things. Not in real life, but we've seen some videos and they can be really, really gross. Okay, next I have the Foley catheterization tray. And Foley catheters were very scary at first because I was new to doing the sterile technique, and every time I did something, I'm like, oh God, I don't want to break my sterile technique. So you have to get really good with sterile technique because you don't want anybody coming up with any nosocomial infections. In this packet, it has a silicone-coated latex catheter, a drainage bag with anti-reflux towel, which I think is to prevent backflow. There are a pair of vinyl gloves, lubricating jelly, povidone iodine swab sticks, 3 milliliter syringe pre-filled with sterile water to inflate the balloon once the catheter gets to the point of the urinary bladder. There's an underpad, a fenestrated drape, specimen collection container with lid and label, a tray, and CSR wrap. Really cool stuff. So that's all that I had in my nursing care packet. But when I go to lab, I also take my clinical portfolio, which has my nursing procedure guides, which I showed you in a previous video. It also has my checkoff list. Okay, clinical portfolio review. It has all the things that we've learned in lab that we are allowed to do in clinical. So if we've learned it, we can do it. And we haven't gone through everything on our list, but we've done quite a few things. So we're learning a whole lot. So I hope you enjoyed this video, and I hope you guys get to play around with some of these cool things as well in your lab practice and in clinical. But that's it for today, guys. Thank you so much for watching. Don't forget to subscribe, rate, and leave comments. And I will see you on the next video. Thanks so much for watching. Bye-bye.